you today?
Good, how are you?
Good, thanks. Did you get your Wheaties?
I know, it's Cheerios.
Cheers.
Well, good afternoon, and thanks to all of you for joining us, and thanks to those that are either watching online or on television. I'd first like to start by saying I know this was a very difficult weekend on a lot of Virginians because of the ice storm. I know there are individuals in Hopewell that still don't have access to water, and everything is being done to return that. There are still people across the Commonwealth that don't have electricity, and we certainly regret that. And our Virginia State Police and other law enforcement agents answered to hundreds of motor vehicle accidents. And unfortunately, we have some more weather coming. So I would pay attention to the TVs, the press, and also be prepared. But today, I want to start with some exciting updates that we have to share. Our COVID numbers are going down, and our vaccination numbers are going up. And today I'm excited to show you our new statewide vaccination pre-registration system. First, I'd like to take a quick look at the data. We've administered now more than 1.4 million vaccine doses. 12.4% of Virginians have received at least their first shot. That puts us 12th in the nation. We're the 12th largest state, so that's exactly where we should be. We've used 87% of the shots we've received, which puts us 7th in the nation. So we're getting these out the door as fast as possible. On average, we're giving almost 34,000 shots per day. As you know, our goal is to be doing 50,000 shots a day. We have the infrastructure to do that when we can get the supply. And I talk to our governors, our fellow governors every day. Supply is the key to getting this vaccination into everybody's arms. Part of the infrastructure is making sure we have enough people who can put those shots into arms. This week I was glad to sign emergency legislation that will allow more medical professionals to give vaccine shots. Folks like dentists, medical students, and others. I want to thank Delegate Lamont Bagby and also Senator Savon Donovan for sponsoring this legislation. The bill also requires vaccinators to collect race and ethnicity data, which will help us fill an important data gap. Tracking this is a critical step to ensure we're distributing vaccine equitably and including the communities that are most vulnerable to getting the virus and also getting sicker from the virus. Now I'd like to talk about the pre-registration system. We have heard you. You asked for a unified statewide system where you can pre-register and get confirmation that it went through. And Virginia is delivering. Yesterday, we launched the website and pre-registration tool. The response has been very strong. At the peak, the new site was getting 300 registrations per minute, and it averaged 150 registrations per minute. All told, 240,000 Virginians signed up since this launched, and I'm one of them. That tells us that the system is working and that it's meeting a demand. Today, we're launching the second component of this system, a dedicated call center for those folks who are more comfortable talking to a human being than going online. Together, this is a one-stop shop for Virginians to pre-register for vaccination so that when your turn comes, the health department can easily reach out to schedule you for your shot. I'd like to walk you through what this looks like. The new site is vaccinate.virginia.gov. When you type that in, this is what you will get. Now, let's say you want to pre-register. You click the blue button in the middle that says pre-registration. It will take you to this page where you can check your registration status or click sign up to get to the pre-registration form. A couple of important points that I want to note. One is that if you have already pre-registered through your local health district, you don't need to register again. The data from local health departments is being automatically imported into the new system. 1.6 million records, I will repeat that, 1.6 million records were migrated over the weekend. Everyone who previously registered is still on the list. But if you know you pre-registered and you can't find your name on this new system, don't worry. While much of the data migration from local health departments is done, the rest of it is continuing this week. So it may take several days for your name to show up in the centralized system. If you don't find your name, just check back in a few days. If you haven't pre-registered, here's the form you'll fill out. When you're done, you'll get a confirmation. This new system will provide functionality we have all been asking for. One, it's centralized, which makes it easier on our local health departments. And two, it gives you confirmation that you've signed up and periodic update emails. The first one went out last night, and I also received that email. Now, let's talk about the call center. We know that some people prefer to talk to a live person. I'm one of those people. That's why we also made a dedicated call center a priority, and that launches today. You can call 877-VA-ACTS, excuse me, let me start over. 877-VAX in VA. Maybe that's a little bit clearer. 7 days a week between 8 a.m. and 8 p.m. And for those that don't want to connect the letter to the number, this is the number, which I also appreciate, 877-829-4682. So I'll repeat that because that's not written down, 877-829-4682. You can speak to someone in English or in Spanish, or you can get a call back to speak to someone in 100 other languages. In addition, the call center will prioritize callers age 75 and up and those who speak English. Excuse me, those who speak Spanish. I apologize. We have hired 750 call center workers to staff those phone lines. 69, or about 10% of those, are Spanish speaking. We expect this is a starting point, and we will hire more people as needed to meet the demand. The call center will allow you to talk to someone who can answer questions, and they can help you get pre-registered. They have the same access to online pre-registration forms. So if that works better for you, please call. But I do not want to say that as this launches, many people will be calling. If you can use the online form, please do so, and let our call centers workers help those who don't have internet access or who are having trouble with the online form. And a note of caution, unfortunately, there are people out there who would take advantage of the high interest in vaccination. Please remember, and this is so important, the vaccine doesn't cost you anything. Don't respond to anyone asking for money to reserve your shot. Now, to ensure that the majority of people listening get the essential information on how to access this system, I'd like to invite our Director of Latino Outreach, Maribel Constaneda, up to deliver this message in Spanish. Maribel, welcome. Thank you.
Buenas tardes. Mi nombre es Maribel Castañeda y soy la directora del Alcance Latino para la Oficina del Gobernador. Virginia está lanzando un sistema de preinscripción para vacunas en todo el estado, con el fin que haya un proceso único y completo para que así todas las personas en Virginia se preinscriban para recibir la vacuna del COVID-19. El gobernador entiende que nosotros queremos una forma sencilla y fácil para obtener la vacuna del COVID-19. Quiero aclarar algunas cosas. Para registrarse en línea, vaya a vaccinate.virginia.gov y haga clic en preinscripción. Se le hará una serie de preguntas básicas y cómo prefiere ser contactado, cel, mensaje electrónico o mensaje de texto. Ya cuando termine el registro, recibirá un número de confirmación. Recibirá actualizaciones periódicas en español para que sepa que todavía está en la lista. Si ya se encuentra en el sistema, no envíe otro formulario. Esto podrá retrasar el proceso un poco. Si ya envió un formulario de preinscripción o una encuesta con su departamento de salud local, puede confirmar si quedó preinscrito en la página de preinscripción. Si prefiere hablar con alguien directamente, puede llamar al 1-877-829-4682. Una vez más, es el 1-877-829-4682. La línea directa está abierta de las 8 de la mañana hasta las 8 de la noche, todos los días. Habrá representantes quienes hablan español para responder a sus preguntas y pueden ayudar con su preinscripción o verificar su registro. La preinscripción es solo el primer paso del proceso. No programa la cita para que reciba la vacuna. Recuerde que nunca vamos a preguntar sobre su estado migratorio y la vacuna es gratis para todos. Gracias.
This new system will be a tremendous step forward in our vaccination work. We've been getting around 130 first doses per week from the federal government. That's an increase from the early weeks when we were receiving about 105,000 doses per week. But it's obviously not enough to meet the demand. I know that President Biden's administration announced yesterday that they are increasing allocations to the states, and that is wonderful news. We'll take every dose that we can get. We are in regular contact with our federal partners, both in the Biden administration and in our congressional delegation. I promise you we are not shy in asking for what we need, and later this evening I'll be in communication again with our congressional delegation. And we have had a very good working relationship, and they have been very helpful, especially with COVID relief. Just last week, I joined Maryland Governor Hogan and D.C. Mayor Bowser in writing a letter asking that the federal government help us vaccinate federal employees, as well as contractors, which includes thousands of employees in Virginia. I spoke about vaccine supply limitations. An additional and separate pot of vaccine is going directly to our pharmacies through their partnership with the federal government. Right now in Virginia, that's just one pharmacy chain, but our health department is working with the Centers for Disease Control to put a greater emphasis on community pharmacies. We also want to ensure that pharmacies can work with our pre-registration system. I know that a lot of our small pharmacies are willing and eager to vaccinate their patients. Many of those pharmacies haven't gotten any doses yet because the supply is so limited. But we know that small, independent pharmacies are an important partner in this effort, and we're working to include them. I want to take a moment to also look at our COVID trends. I mentioned earlier that our cases are trending down, and that is great news. So you can see that here. And our hospitalization numbers are going down as well, which is also excellent news. We need these trends to continue. Cases down, vaccinations up, as we develop a long-term plan for how to get back to life as we knew it a year ago. Remember, our first case of COVID-19 was on March the 7th. We're almost at a year. I know that everyone has lots of questions. Will more people be able to come watch their kids play sports? I hear that every day. Yes, they will soon. Next week, sports start moving outdoors. So starting this Monday, we'll expand the number of spectators allowed at outdoor sport events up to 250, provided everyone maintains their social distancing. Next question. Will children be able to go to overnight summer camps? Yes, they will this summer. What about outdoor events? Well, we're moving on that as well. And we'll be working with stakeholders to move forward safely over time. But I need to be clear, the basic safety needs will stay in place for the foreseeable future. Wear a mask, wash your hands, maintain your social distance. This applies to people who have been vaccinated as well. We know that these measures work. As we look at all of the measures that are in place, we're going to take a deliberate, cautious, step-by-step approach. We will move thoughtfully and safely over time. I am pleased, however, to see that our school divisions are stepping up to the challenge I set for them 2 weeks ago. I asked our schools to move aggressively toward plans for how to have in-person learning options by March the 15th. At that time, if you remember, about a third of our school divisions lack plans for in-person learning. That represents 500,000 students in Virginia. Today, that number is down to just 3 or 4 school divisions, and we're working with them on solutions. In other news, I want to remind everyone Virginia has lots of opportunities for you to learn more and get the information that you need and that you deserve. You can find it at vaccinate.virginia.gov. Or tomorrow, William & Mary is hosting a forum with Dr. Anthony Fauci. You can watch it online on the college's website at 3:30. And finally, as I mentioned earlier, a serious winter storm is forecast for parts of our Commonwealth. This map shows you the worst-case scenario snow totals that the National Weather Service at Wakefield is predicting. For many of us, we'll also be seeing significant ice. This could result in more power outages, so Virginians, now is the time to prepare. And if you don't need to be out, please stay at home. I want to take this opportunity on behalf of all of us in Virginia to thank all of the utility crews at Dominion Energy, Appalachian Power, and our co-ops throughout Virginia. And I also want to thank the Virginia Department of Transportation and other road workers, the Virginia Department of Emergency Management, the state police, and other law enforcement, and everyone who works every storm to keep us all safe. They did a great job in the storm that we just had over the weekend, and I'm grateful to them for everything they'll do in this storm as well. So pay attention to the forecast and please be prepared for the worst. Thank you. I'll be glad to take questions. Cam.
Governor, just regarding the storm that is coming tomorrow, do you have any concerns about the people who are still experiencing those prolonged power outages? I know for our area, that's Dinwiddie, Nottoway, the south side, and just how the power companies are handling, the response to that, and is there anything the state is doing to try and help out those areas?
Well, it's been a combined effort, Cam, as you might imagine. I mean, a lot of the power outages this past weekend were because of downed trees. And obviously our Department of Forestry is helping. They've been on the scene with chainsaws. The Virginia Department of Transportation clearing the trees from roads and on power lines. So everybody's been working well together. And unfortunately, it looks like we're going to have a double whammy. And we need to prepare for the best or for the worst. But I just would encourage all Virginians to. This storm is supposed to come tomorrow and into Friday morning, and everybody needs to be as prepared as they can. And I guess one last thing I would say, not that I'm a driving expert because I don't even drive now, but there's obviously a difference between driving on snow and driving on ice. And I don't care what kind of equipment you have, whether it's four-wheel drive or whatever. If you don't need to be out when there's ice on the roads, please stay at home. And it's just everybody is stretched thinly. I mean, the Virginia Department of Transportation will do everything that we can to prepare and keep the roads safe. But we have to remember our state police and other law enforcement agents are out. And so if everybody can just stay home, that will be in everybody's best interest. And, you know, we'll, as we always do, we'll recover from the storm, from whatever happens, and get people on their feet. But I think the beginning of your question, am I concerned? Yes, I get very concerned when people don't have power, especially those that are vulnerable, when people don't have running water. Those are things that we, you know, just take for granted, and it's very detrimental when we don't have these. And we'll do everything that we can to make sure that these people have the services they need. And
then just to follow up on your announcement regarding that 250 capacity for sporting events, I believe it was late last month, several dozen athletic and entertainment venue operators sent a request to consider percentage capacity versus that fixed number. Is that something that you are considering, or are you going to be sticking to the fixed number?
We are, and the recreation, which the high school leagues fall under, is what we are announcing today and we'll put that executive order out later today. It's all ready to go. And to your question, I think, you know, there are venues like our NASCAR. We have a racetrack in Richmond, which will hold a race in April. We have the Squirrel Stadium. We get a lot of, you know, questions about that. And so we're talking to the owners, the managers of these venues, working together, sharing our ideas. And so we'll have further announcements, hopefully next week on that, because people, one, we want to get back into those venues. We want to do it safely, but also we need to plan. As far as ticket sales and those types of things. So we're working with those individuals.
Greg Schneider, Washington Post. Thank you. Governor, I wonder, with the numbers improving and the current set of restrictions set to expire at the end of February, other than what you mentioned today with outdoor sports, are you looking at a further loosening of restrictions after the end of the month? And then separately, what do you think about some of the efforts in the General Assembly to move along opening up schools? Do you think that those are enough? And specifically the effort to create or the suggestion of creating an education corps of education reserve corps for teachers?
Yes, thank you, Greg. A two-part question. The first was our efforts to ease the mitigation measures, and the executive order that we published this afternoon, I think, will address a lot of those, Greg. And it's, you know, I think the point to all of this is that the numbers are coming down. We recognize that. That's all good news. The number of vaccinations are going up. But we still are not out of the woods yet. We have a variant, as you all know, from the UK that we're watching very closely. B.1.1.7 is the name of that. So we're kind of in a race with time to get people vaccinated, but to continue to follow the mitigation measures. But in answer to your question, Greg, we are having discussion, and we'll publish those later today, and then there'll be more announcements, I think, next week. We want to get back to our near normal lives that we had prior to COVID-19, but we want to do it safely, we want to do it responsibly, and we also want to do it with input from as I said earlier, the owners, the managers of these venues. The second part of Greg's question was about school. And certainly there's been initiative, and I commend our legislators. I think we all agree that we want to get our children back into school as soon as we can. We know that's where they learn best. And as I said in a previous press conference, our children have sacrificed, and now it's time for us to take care of them. The CDC put out some guidelines. There's been a little bit of confusion, but excuse me, we're going to continue to follow the guidelines that we're using in Virginia. I think one of the things, Greg, that we all need to agree upon, and you ask is what they're doing enough. In order to provide a world-class education to all of our children, we need to have a talented workforce. We need to have teachers that are properly credentialed. And this is a reason, one of the things that we've noticed over the years is that, we need to pay our teachers. Our teachers in Virginia are working at less than the national average, and that's just not acceptable to me, and I don't think it's acceptable to the legislators. So in our budgets, as you know, the Senate has a budget, the House has a budget, we propose a budget. We want to give our teachers a raise. And again, we want our most talented, hardworking teachers to be there. If there are options to look at, should we make it easier to credential teachers from other states that are coming to Virginia? We've done that. Should we extend the time that a substitute teacher has? We've done that. So we've taken a lot of measures in Virginia to make sure that we have the proper amount and the credentialed teachers in the classroom. And I'll continue to work with our legislators. Again, we're all on the same sheet of music. We want to provide all of our children access to a world-class education, and that means we want our children to be back in school. Henry, you had your hand up, and I'll come over to you next. Thank you.
I think most Virginians are very happy that there's a centralized website now for vaccination, but some might ask, why did it take so long? So what would your answer be to that?
Yeah, Henry, initially, we were registering through our health departments, and that was going well, but we saw what was happening, and people were asking for more, and we, as I said earlier, Virginia responded, and it's a logistical challenge, as you might imagine, to have a central registration system, but we've had a lot of really good, talented people working around the clock to make it happen, and I'm just pleased that it's available now. And I think as we move forward, I said we've vaccinated 1.4 million in that ballpark, but we have 8.5 in that ballpark Virginians, so we still have a lot of road ahead of us, and I think this will really help us, as we move forward, and it'll be much more efficient. And I mentioned, and I was kind of facetious about it when I said it, but there are a lot of people, including myself, would like to pick up the phone or be able to ask someone a question and get a response. And so that's something that we all felt very strongly about. But I think the call center is really going to be helpful as well, where people can pick up the phone that may not have access to the internet. And again, we've talked about equity and doing this as expeditious as we can, but we've put all these tools in place to really, at the end of the day, get Virginians vaccinated. And I think we can be proud that we're in a good place. Do we have more work to do? Absolutely. And as I've said before, I'm not going to be satisfied till everybody in Virginia has access to a vaccination.
We're going to go to the phone and we'll come back to that. Hannah McComsey, ABC 13.
Hi, Governor. You mentioned supply limitations when it comes to this vaccine. So what are you doing to advocate for Virginia to get those increased doses? And can you touch on the infrastructure that Virginia has to be able to mass vaccinate rather? And then when it comes to schools, are you setting a hard date on when schools need to have kids back for in-person learning, not just having a plan for it, but actually implementing it?
Yeah, let me answer the last part of your question first, and then I'm going to let Dr. Avula address some of this. But as far as teachers being vaccinated, we certainly want our teachers to be vaccinated as quickly as they can, and this is why we made them a priority. They're in 1B, and I've been to a lot of those vaccination sites, and I don't have the percentage of what teachers have been vaccinated in Virginia, but it's been significant, and while not all of them will be vaccinated by the 15th of March, I think a large majority of them will, and they've been more than willing to receive the vaccination. So I've been pleased with that response. As far as what am I doing to get more doses in Virginia, I told you at the beginning, I'm not shy. We get on these calls every week, sometimes more often than a week, and I'm not the only governor that's not shy, but we have told the president and his team we need more doses. We're getting about 120,000 plus or minus some. We get 26,000 through the pharmacies, but we need upwards of 350,000 a week. So we're getting about a third of what we need, and whatever they can do in Washington, working with the pharmaceutical companies to get us more supply, we have the infrastructure in place. We just need more doses. So, Danny, if you could add, thanks for being with us today.
So the question that I heard was, what are we doing around mass vaccination? And You know, from the beginning of this, we've talked about the multiple channels that vaccine comes through, primarily through health departments, hospitals and health systems, pharmacies and providers. Simultaneously, we were working on plans and continue to work on plans for fixed site mass vaccination. Obviously, the longer that it takes for supplies to ramp up, the further that puts that mass vaccination concept down the road, right? We don't have enough supply to feed large mass vaccination channels, but the capacity is there. As the governor said earlier, you know, we started this campaign wanting to get to 50,000 doses a day. We've had multiple days where we've exceeded 50,000 doses a day. So the capacity really just in the providers that we have on board, we can do this. We need the supply. I think we will continue to evaluate, is there a period of time where supply increases enough and demand stays high enough that a fixed site mass vaccination makes sense? And so we're doing some modeling about how that increased supply will impact us, and if there's a window for us to continue to deploy the National Guard and do fixed site mass vaccination. We'll just have to see how quickly supply can ramp up to meet that need.
I have a weather question. As thousands of Virginians have been, without power for several days now, they've been forced to throw away everything inside their freezers, their refrigerators. Of course, that's a huge expense. Some of them are asking their localities, will there be any help for us as far as the expense goes? I saw at least one locality yesterday say, we're actually waiting on the state to see if that'll happen. Today, the White House said that they will accept any state's request for help from FEMA. So have you reached out and asked the White House for FEMA help? And if not, why have you not?
Yeah, no, that's a great question. And the question was about when people lose power, obviously they lose their perishable items in their house. And, I haven't reached out and specifically asked for that, but we are in touch asking for FEMA support, and I'll continue to do that. I think you bring up a great point. How can we, help those that don't have the means to replace the goods that were lost? So, did you want to add some words, Secretary Miranda? Come on up.
Governor,
Yes.
I just wanted to add, Governor, that VDEM, Department of Emergency Management, has been in touch with FEMA. We declared a declaration last weekend storm. That extends for 30 days. So we anticipate that applying to this storm, since it's same weather system. There's certain thresholds that have to be met with respect to the damage, but we're accumulating all of that information from the local districts. All of that will be supplied. So obviously our wish is for FEMA to reimburse the state for its expenses. But so that is a process that is in place.
So there's no real timeline for when some Virginians, who've already lost hundreds of dollars may get some relief at this point?
Well, there's different programs. There's small business, there's local assistance, so there's a variety of programs that would apply. But with respect to the state, we are working through VDEM with FEMA to make sure that, we're made whole for the expenses.
Hey, good afternoon. So rural fire and rescue departments like in Rockland County have had to fill in gaps, such as for those without internet and computer access to get pre-registered before the state had this, the central system. What is being done so rural and fire and rescue departments will no longer need to fill in these kinds of gaps and can focus instead on responding to other parts of the health crisis?
If I stay on the phone, if I heard your question correctly, that the fire and rescue departments in rural areas have been helping individuals, assisting them with registration. Was that the crux of your question?
Yes, especially those without access to the internet or, computers, especially, a real problem that you've spoken about in the western part of the state that we see over here.
Yeah, well, first of all, coming from rural Virginia, I commend those fire and rescue departments for helping individuals, because that does go beyond the call of duty for them. But what I would do with the call center now that we have available, especially for those that don't have access to the internet, if they have access to a phone, to please give them that information and have them call, and I think someone can be on the receiving end of that and help them. But in the meantime, if there's anything you all can do locally to help these individuals, again, I commend you for helping as well. I'm fine. Thank you for asking. Hope you are as well.
I'm good, thank you. Could you speak to the parents and families who have medical waivers? They're caring for their challenged young people, if you will, and they're calling saying that their funds may run out on March the 11th, and they wanted to know if you could have any hand in securing their funding, because they're saying the federal government has already agreed to keep it going, but I think you have a role to play within this.
Are you talking about like for Medicaid waivers?
Yes.
Is that? I wasn't aware that they were going to run out. As a matter of fact, in our budget, which won't take place until once we sign it until July 1, but we're actually adding to our, or at least we propose to add to our Medicaid waiver. So, but if I can get some more information, we will certainly reach out to those folks. And Dan, I don't, are you aware of any?
No, not
Secondly, could we get some update on the equity task force efforts to reach minorities and making them feel comfortable getting vaccinated? We haven't heard any update.
Yes, I'm smiling. I have Dr. Underwood is with us, and Dr. Underwood, I'm going to let you talk a little bit about what we're doing and maybe fill in, but welcome.
Thank you, Andre, for the question. Janice Underwood, Chief Diversity Officer to Governor Northam. The question was some updates with the Health Equity Working Group. As you know, equity has been one of our guiding principles since the beginning of the pandemic, and we moved our group from working with 66 localities to do targeted outreach for public health information, testing, food distribution, and so much support with 66 localities. But we also now have turned our sights towards vaccination events. And the Health Equity Working Group, for which I'm one of the leaders, along with Sable K. Nelson Dyer from the Office of Health Equity, what we're doing is we're now looking at data and using a real data-driven approach so that we can identify those who are most vulnerable to COVID-19 and therefore create an equity methodology to determine where our vaccination sites should be. We're also working very closely with Secretary Kerry, Dr. Oliver, and Dr. Avula and the governor, and really trying to figure out how do we and how should we allocate doses and vaccinations, because we know that certain communities have had to carry the burden of COVID-19 more than others. In addition to that, the health equity team is working across secretariats. We're working with Secretary Carney to think about equity issues with regard to opening schools and in-person instruction. Working with the Secretary of the Commonwealth's office, in particular, the Director of African American Outreach, Tracy DeShazer, and you heard earlier from our Director of Latino Outreach, Maribel Castaneda, working to make sure that we can galvanize communities so that we can serve those who are most in need. Equity, again, is our guiding principle, and we're using a data-driven approach to make sure all Virginians get what they need. Thank you.
Thanks, Janice. Appreciate it.
Drew Wilder, NBC4.
Thank you, Governor. I wanted to go back to the emergency legislation that was signed to give more people the ability to give the vaccination. You mentioned medical students as well as dentists and some others. Can you talk about what that actually looks like in practice? Are dentists and these others, are they going to be using their own existing practices to administer vaccine? Will they be given a location to go and help out at a different place? What does that actually look like when it happens?
Yeah, it's a great question. The question is about dentists, medical students, other health professionals that are qualified, have the credentials to administer injections. Where will their services be needed and used? And I think rather than, for example, dental offices, administering vaccinations, these will be individuals that will be volunteering through the medical corps to to work at our different vaccination sites across Virginia, whether that be at a mass vaccination site or whether it be at a house of worship or whatever. So the legislation will allow those individuals to be credentialed to be able to give those vaccinations. The other thing that it will do, and I mentioned this earlier, that piece of legislation will do, is it will help us better collect data. And especially when it is regarding equity and demographics. So it's a very good piece of legislation. Delegate Bagby and Senator Donovan, I think, was very forward-thinking for them to introduce that, and it'll really help these individuals be part of the solution.
I know that with the new statewide registration system, Virginians, for example, can't sign up for doses available at CVS Pharmacy and I think any other providers. Can you talk about when people sign up for the system, what vaccines are they eligible for and which are kind of separate? And then two, I know some folks yesterday...
Hold on a second. Just if you don't mind, Mel, I won't forget. I won't forget that you have a second question, but I might forget what the second question is. So I'm going to let Dr. Avula answer that, and then we'll go to the next question. But thank you. Thank you.
Yeah, of course. No, the question was that what exactly does the pre-registration system cover? We know that CVS is using its own registration system above and beyond what the state is using. So pre-registration puts you in line for any vaccination that's coordinated by the health department and their partners. The way that vaccine is being distributed into communities, health departments are using a bunch of different channels to get vaccine out, right? So some of the vaccine is going to private providers who are doing the 65 and up population, for example, or some might be going to pharmacies to do those with underlying conditions. That strategy looks different in every community, but all of it is built off of these pre-registration lists. So each health district will sort that pre-registration list for various events happening through those various channels in their community. Now, CVS, as we've talked about here, we tried really hard for them to get to use those pre-registration lists to populate their clinics. Because of their national registration platform, they were unable to do that. However, this week they did start to ask us, hey, if we have wait lists pop up or we have no-shows, we would love to call through your list. So that will create a little bit of opportunity for folks who are on our pre-registration list to access them. And then as new pharmacies come on board, we anticipate 3 to 4 weeks down the road, we'll see new pharmacies. We've already reached out to both the CDC and to the state and national leadership of some of those pharmacy chains to start that work now so that we have more opportunity to integrate our state priorities and our pre-registration lists in whenever these pharmacies do bring vaccine into Virginia.
Don't go too far here. What was your second question, Mel? Was it for Dr. Avula as well?
It's for you.
Oh, good.
I know some folks yesterday were not satisfied with the translation of the vaccine registration form that was made available in Spanish. I read through it. It was a little clunky. Just curious about what efforts the state is making to make sure that the Hispanic population that relies on that service feels included and that they're being adequately serviced.
It's a great question. Norm, you want to tackle that one?
Certainly.
All right.
Danny may know more, so you can back me up. Thanks, Mel, for asking about the translation and difficulties around that with the launch of our pre-registration form. The vendor that we acquired for building our pre-registration form utilized Google Translate. We had some issues with that. Yesterday evening, we acquired a vendor through the work of the Health Equity Work Group within our Virginia Emergency Support Team. They've translated it. This vendor utilizes native speakers of Spanish, and so this is human beings as opposed to AI doing the translation, and it's much more reliable and culturally proficient. And our vendor is in the process of manually putting that into the code. You can't just upload it. You have to change every single line and put things in, and that will take 24 hours or so.
Violet.
Hi, yeah, I have a question about shareable links for vaccine scheduling that has caused problems with people showing up when they weren't supposed to show up. What's the state doing to address that?
So the question was about shareable links, the registration platform called PrepMod. One of the loopholes is that when you get a link, you can send it to somebody else. They can actually schedule an appointment. We recognize that that has been a huge issue for providers on the ground that are scheduling appointments and really trying to ensure that it's people on our lists who are prioritized. We are working with the vendor. They have a deadline of, I think, February 23rd or February 24th to make that fix. And there's a couple of other things that we're tweaking with the vendor. We hope that will be updated and that will be resolved by the 24th.
Hi. My question has to do with you're lifting some restrictions and letting more people at outdoor gatherings and such. And, you know, there's a sense now with people, especially those who've gotten 2 shots, that, you know, they should be more free to move about the state and do more things, which is sort of creating like this 2-tiered system of people in Virginia, those who are vaccinated and those who are not. And I'm just wondering if there are some kind of metrics that will play into decisions to lift more restrictions with the percentage of people who are vaccinated, or you know, how does that play in to your decision making?
No, I appreciate the question. It's a good question, and I will try not to medically get too much into the weeds. But the question is about, well, if there's more people vaccinated, isn't it safer and isn't it time to lift some of these mitigation measures? And I think the key that people need to kind of look at down the road is what we call herd immunity. And just the fact that we've vaccinated a little bit over 10%, 12% of our population, those people that have been vaccinated are safe now, we believe, from if they acquire COVID-19, they're not going to get sick from it. But that doesn't mean that they can't continue to spread it. And that's where the challenge is. And so what we're really looking at, and I think part of your question was what measures, what data do we follow to make these determinations as to when we can ease some of these measures. It's really community spread and what the percent positivity, how many cases per 100,000 we're seeing in different communities, and we're not there yet. As you know, our positivity rate is around 10%. It's coming down. The number of hospitalizations are coming down. All this is good. Vaccinations are going up. But until we get to herd immunity, people will need to continue to follow these measures of wearing their mask, of social distancing, keeping their hands washed. That's when we can finally put this pandemic in the rearview mirror. So yes, we're making good progress, but we're not at the point yet where we can lift a lot of these measures. And as our numbers come down, we watch this every day. We will lift the measures just as soon as we can. I, along with everybody else, I think in Virginia, in this country, want to get back to our normal as soon as we can, but we want to do it safely and responsibly. And I think if you go back, and we won't put that slide up again, but if you look at the numbers of cases, it looked like the Empire State Building, that big mound and then a tower coming out of the top. But we don't want to go back there. And so that's why we're going to do this, following the data and do it as carefully as we can moving forward. So just again, thank you for being with us today. Again, we're here to talk about COVID and the central registration, the call center, but also just remember we have a serious storm approaching us tomorrow and into Friday. So be aware of that, get prepared. And the last thing I would say, and I know time is of the essence here, but one of the things that this pandemic has really taught me is that there are so many good people in Virginia, so many people that have been helping each other. And so as we move forward, whether it be with COVID-19, the vaccination process, making sure people have access or transportation, whatever, or even tomorrow and Friday, helping each other when they're in need because of the storm, because of losing their water, because of losing electricity, whatever. just reach out and make sure we're taking care of each other, and together we'll get through this. So thank you, and stay safe and healthy.